Mandible lower jaw. Single bone but formed by two halves. You can see this is a single bone but it is formed by two halves. Largest bone of the face. The two halves are not completely fused, joined at mandibular symphysis. We'll discuss. Okay, so this part is the mandibular symphysis. At this part only, the two halves are joined. So this part is called body of the mandible, and from this two rami arises. Okay, so this one is the right side ramus, and this is the left side ramus. First, body of the mandible. You can see. So this part is called body of the mandible. Body of the mandible. Lingual or inner surface covered by mucosa in life, tongue rests on it. So you can see. So this surface, this is the lingual or inner surface. The tongue of the animal rests on this surface. Then mental or outer surface related to the lower lip. So this one. So this is the mental or outer surface. So below this you will find the lower lip. Then rami of the mandible. Two rami diverge caudally from the body. You can see this is the body. Okay, so from this two rami, they diverge caudally. They enclose the mandibular space. So this space is called mandibular space. You can see. So these are the two rami. Okay, this is the body and the space between the two rami. So this space is called mandibular space. Each ramus has a horizontal part and vertical part. You can see. So total structure means, so this part is the body. This whole structure is the ramus. It has a horizontal part and vertical part. The band between them is called the angle, most prominent part. So this part is the angle of the mandible. Lateral surface of ramus. So this is the all lateral surface of ramus. Okay. Widest at the angle. At the angle, the lateral surface is widest. Okay, widest. Then narrows at both the ends. It is narrows at both the ends. Horizontal part is smooth and convex. Vertical part nearly flat. So this is the horizontal part. It is smooth and convex, and the vertical part nearly flat. Then lateral surface of the ramus near the angle. So here. So at this point, what you will find? You will find rough area line for masseter muscle insertion. You will also find mental fossa near the body. So you can see. So this depressed area is the mental fossa. It contains mental foramen. Okay. This is the opening of the mandibular canal. Mental foramen is the opening of mandibular canal. You will also find incisor canal, extension of mandibular canal into the body. Medial surface of the ramus. So this is the medial surface of the ramus. In the horizon, this is the horizontal part. It is the attachment for mylohyoid muscle, junction with the body. So where it joins with the body at this area, you will find what? Small fossa for geniohyoid and genioglossus muscles. Then medial surface of the ramus in the vertical part. So this is the medial surface of the ramus or medial surface of the vertical part of the ramus. What you will find? You will find mandibular foramen. You can see this is the mandibular foramen. It is the posterior opening of the mandibular canal located mid-height. So from this mandibular foramen, you can see arises the lingual groove. Okay. So lingual groove leads forward and downward from the foramen for lingual nerve. So this groove is for the passage of lingual nerve. Then borders of the ramus. Dorsal alveolar border. So this border you can see dorsal or alveolar border. So in this border you will find 6 number of alveoli or socket for lower cheek teeth. Okay, you can see. So here you will find 6 number of sockets or alveoli for the lower cheek teeth. Ventral border. Okay. So this is the ventral border of the horizontal part and ventral border of the vertical part. Horizontal part, ventral border convex, posteriorly shows smooth impression left by facial vessels and parotid duct. The vertical part thin and concave. This is the ventral border of the vertical part, thin and concave. Okay, and this is the convex. The extremities of the ramus, anterior extremity joins with the body. So this is the anterior extremity joins with the body. Posterior or articular extremity has two major projections. Coronoid process in front. You can see. So this is the coronoid process in front you will find, and behind this you will find what? Condyloid process. Okay, and between the condyloid process and coronoid process you will find a notch. Okay, this is called mandibular notch, which transmits mesenteric nerve. You can see this prominent coronoid process long comes backward into the temporal fossa for the attachment of temporalis muscle. Then you will also find articular condyles. You can see these two are the articular condyles. Okay, transversely elongated. They are transversely elongated, located approximately 2 inches below the coronoid tip. Okay, so below the coronoid tip there. So this is the tip of the coronoid. Okay, just below this you will find the articular condyles. Articulates with the condyle of the squamous temporal via interarticular cartilage. Medial projection gives attachment to the lateral pterygoid muscle. Okay, so medially they show projection which gives attachment to the lateral pterygoid muscle. Hyoid bone located between the vertical rami of the mandible. Okay, so you can see this whole bone is the hyoid bone. It is present between the two vertical rami of the mandible. It is composed of a body or basihyoid. We'll discuss glossal or lingual process, 4 pairs of cornua or cornu, thyrohyoid, thyroid cornua, keratohyoid or small cornu, epihyoid or middle cornu, stylohyoid or great cornu. First, body or basihyoid. So you can see, so this part is the body. This part is the body or basihyoid. Short transverse rod-like bone. Anterior border bears a short blunt glossal or lingual process. So you can see at the anterior part of the body you will find a blunt process, short blunt process. This is called glossal process or lingual process. So this is the body and this is the glossal process or lingual process. Then thyrohyoid or thyroid cornua or cornu extend upward and backward from the body. So you can see, so these two are the thyroid cornu. Okay, they extend upward and backward from the body. So this is the body. So they extend upward and backward from the body. Thyroid cornu. So these two are the thyroid cornu. Then keratohyoid, small cornu. You can see. So these two are the keratohyoid, small cornu, directed upward and forward. At the lower end, this is the lower end. Okay, articulate with the cartilage between body and the thyrohyoid. Okay, so this is the thyrohyoid, this is the body. Here you will find a piece of cartilage, and with the help of this, it articulates small cornu. At the upper end, connected to the epihyoid via short cartilage. So this is the epihyoid, okay, or middle cornu. And at this point, you will find a short piece of cartilage for connection. So small cornu attaches with the epihyoid by a small cartilage bar here. So here you will find a small piece of cartilage. Here also you will find cartilage. At this point, you will find the cartilage. Here also you will find the cartilage. Then epihyoid or middle cornu. This one is the middle cornu. Okay. Small curved rod connects small cornua below to the great cornua above. Means below this you will find the small cornu. Okay. Above this you will find the great cornu. Then stylohyoid or great cornu. You can see. So these two are the great cornu. Okay. Largest part of the hyoid directed upward and backward. At the lower end, they articulates with the epihyoid. Okay. At this lower end, they articulates with the epihyoid or middle cornu. At the upper end, you will find important structures. So you can see this is the upper end of the great cornu. So one you will find at this part, you will find articular angle. Okay, you will find articular angle, or it is called toe, and this part is called the muscular angle or heel. Muscular angle or heel for muscle attachment. You can see. So this part is the muscular angle or heel for muscle attachment. Okay. Then you will find articular angle or toe. Articular angle or toe. Okay. Connected via cartilage rod to the hyoid process of the petrous temporal. Hyoid bone, a quick review. You can see. So this part is the body or hyoid. Okay. From this arises a blunt process, you can see. So this is the lingual or glossal process. So these two structures, these are the keratohyoid or small cornu, then epihyoid or middle cornu. Okay. Then stylohyoid. Okay. Stylohyoid or great cornu. And this is the articular angle toe. This is the muscular angle or heel.